Where there are certain surgical emergencies to prevent amblyopia and to provide visually related quality of life. What are those? I have only 50 years experience in this particular branch, and now let me tell you about the stimulus deprivation amblyopia, especially in high risk babies. First and foremost is the crucial step in managing high risk infants is to address the lesions and that obstruct the visual pathway from birth or during the early childhood. And always remember that one-sided lesions are more amblyopigenic. It is just like one-sided, everything one-sided is very dangerous. Whether it is amblyopia, whether it is a amblyopia or low also. It is one-sided is very dangerous. So cataracts that are present in one or both the eyes at or after birth in infancy can obstruct the visual pathway and lead to severe type of amblyopia, especially cases of one-eyed cataracts. Then ptosis, drooping of eyelid, which is covering the pupillary area, is also that can cause a intractable amblyopia. Corneal opacities, even the smallest opacity in the center of the cornea, maybe just 2-3 millimeters also, this can result into a dense amblyopia. It needs surgical intervention as early as possible. It is a sort of emergency. Then most of the studies up till now have proved that in congenital cataract babies, if they are operated before 18 weeks of age, this is the age that they have described that you should perform the surgery. What is the age? Before 8 weeks of age. So early. It has better visual outcome. If you perform the surgery on later on, there are so many types. The amblyopia becomes very dense. There should not be, and one more important thing is that there should not be a difference of more than 1 week between two surgeries of both eyes. Again, there will be a chance of more dense amblyopia. So delay in second eye surgery for more than a week is likely to cause severe grade of amblyopia. Then as per recent advances, again, primary intraocular lens implantation are generally advised after the age of 2 years. Nowadays, people are going for IOL as early as possible to give the child a better visually related quality of life as well as good vision also to prevent the amblyopia also. Secondary implantation, the recommended age is around 2 years, after 2 years. Then now the few surgeons, they are going for multifocal IOLs also. They are prepared to prevent the amblyopia and to provide an essential near vision to that child. This is for last so many years I am telling, but nowadays people, they have started using multifocals. They are the most useful for that child to provide a very good near and distant both the vision at a time. Then our aim is, why we are doing it so early? Our aim is to utilize the every day of critical period of visual development so that amblyopia should not settle down and in the form of a permanent visual disorder. Yes, somebody has said that the amblyopia should be treated when the head is born but the body is yet to be delivered. Yes, we can tackle that baby from 12th day onward also. We can keep two flickering lights over the cradle of the child or two amber colored dolls over the cradle of the child, and this can stimulate the eyes. We can start treating amblyopia, to start preventing amblyopia. Then critical period, let me tell you about the critical period of visual development. The critical period of visual development is the period when the developing visual system is sensitive to abnormal insult due to stimulus deprivation lesions. The critical period begins just after birth and peaks at 2 to 3 years of after birth. Then one more period is that the sensitive period to extend, that extends up to 7 to 12 years. It has also good chances of improvement of visual acuity if properly treated. Then one more, people nowadays, they say that there is a visual plasticity in adults also, in adolescents and adults also. But as per the anomalism, as per so many things, it is very difficult, goes on become more difficult and difficult. There are certain practical things, tips and tricks, simple preventive solutions to utilize the every day of critical period of visual development and to stimulate the retinal cells. If there is a surgical delay, that usually happens for any reason of a few days or few months in high risk babies, the first step is to keep the pupil dilated every alternate day in cases of central, anterior polar and congenital nuclear cataracts. Keep small flickering LED lights over the cradle of the child during the waking hours, and do not forget to keep the cornea moist. This simple thing can prevent amblyopia, settling down the amblyopia. And in ptosis also you can put a small Tixo tape during the waking hours, put a flickering light, and but take care of the cornea should not be dry. Then, as per American Academy of Pediatric Ophthalmology and Canadian Academy, no screen time for any kind before the age of 2 years. Use of 10 inches spherical glass. You can provide, if you are not, you perform intraocular lens implantation, you can provide them 10 spherical glasses, bifocal glasses, contact lenses, they are preferred, and provide binocular tablet games to utilize the critical period of visual development. Eye-hand brain coordination vision exercises are preferred over larger screen like 10 inches tab. Should not be at a stage, the child should not play more than 30 minutes, and the illumination should not be more than 60%. But as per the severity, 2 to 4 times the games can be played. Go for Lazy Eye Master games on Android Play Store, and the child can play the games very easily. Eye, hand, brain coordinations. These are available, and especially in case of corneal opacity, if you perform a keratoplasty after the critical period and sensitive period is over, the chances of getting the visual results are far, far better. But if you, in children or in babies, if you perform after the critical period, then the vision doesn't improve much. Then strabismus surgery should be performed as an emergency procedure, especially in one-eyed esotropias, strabismus fixus. Madam has already shown you how to see whether there is a strabismus fixus or not. Then bilateral strabismus fixus, eccentric fixation, congenital sixth nerve palsy, essential infantile esotropia. In all these cases, the purpose is also to enhance the visual acuity that promotes the development of crucial visual functions and the binocular reflexes and the depth perception too. Then cyclorefract. In all these cases, when you are performing surgery in children below the age of 3 years or in babies, cyclorefraction and detailed fundus examination is very, very important, because I have seen one case was operated for strabismus, and afterward they found that the child was having a retinoblastoma inside. So it is always to perform a refraction. That refraction will give you exact number of glasses post-operatively. That you cannot do in babies. So these two things you must perform before performing the surgery on table. Take the advantage of the anesthesia. Okay? And one more tip I would like to give you, you can use, there is a Fugo blade is available in the market now. It's a very nice Fugo blade, means it is a sort of blade where there is no bleeding or there is no inflammation of that particular muscle. This was by Dr. Fugo. And one more, this surgery which I am showing, the here I am using two visco cannulas here. Can you see? Without any muscle hooks, I am using visco cannulas. This visco cannula, if you bend, you can use as a muscle dissector also, dissecting different areas of that area during muscle surgery. And a simple trick too. In this case, if, have you observed one important thing which I would like to show you? That in this case, I have kept the peripheral part of the muscle intact and I exercise the central part of the muscle like this. So that these two things, you will never have any problem of lost muscle, medial rectus lost muscle, or anterior chamber ischemia. This will be, can be prevented by this. Madam has already shown you a very nice technique also, that is plication technique. But there again I feel that in during plication, if you are folding the muscle, there are again chances of obstructing the blood vessels and nerves. I don't know exactly, she is the better person to tell that. And this is a simple technique. I have performed more than 1000 surgeries like with this new technique, and I am very happy. You can try this technique while performing all four muscles at a time. You can perform with this simple technique. Thank you very much.
Thank you, sir. It was wonderful talk and wonderful video you showed us. The new technique we were just discussing. We were planning to start this technique, what you showed here. So,